I'm actually a neuroscientist, and I have a predominantly lab-based role working with the Department of Anaesthesia at Waikato Hospital. One of the goals of the research that I'm involved in this department is to try and understand how anaesthetic drugs are affecting the brain in order to cause the brain to be unconscious. If you could imagine, if you were a patient and you had an upcoming operation, one of the things that you would really want to be assured of is that you wouldn't have any recollection of the operation after it's finished, and that you wouldn't have any experience of the operation during the procedure. So for 99.99% of people this is the case. They have no recollection of their surgery. In 1 out of about 10,000 individuals, the amount of anaesthetic that would normally be required to keep someone asleep is not sufficient, and they actually do have some recollection of their surgery. The research we're doing is trying to prevent that awareness of operations occurring. The problem is we can't predict which person is going to be the 1 out of 10,000 that's going to be the one that will remember. And the reason we can't predict is because we don't really know what anaesthetic drugs are doing to the brain, and that's what our research is about. It's trying to understand what the drugs are actually doing at a level of understanding the mechanisms and what is the drug actually doing to cause the brain to become unconscious. The focus of my work is looking at how anaesthetic drugs affect the spread of activity that goes across the cerebral cortex, analysing how that activity spreads and how the activity is disrupted when anaesthetic drugs are applied. And what we've found is that activity that is normally able to spread freely across the cortex becomes disjointed and disintegrated. It's quite a rare problem, even though it's only 1 out of about 10,000 in total. If you consider the huge number of operations that are actually performed, it's still quite a large number of people. If we can understand what's going on, we can measure it, and then we can apply that measure in the operating theatre as a monitor to be able to say, yes, with absolute surety, this person is unconscious.